For the most part, if you look at back pain, it's an incredibly common phenomenon. 20% of the population at any given time has back pain. 40% of the population has had it within the last year, and 80% of the population have had it sometime in their lives. So it's ubiquitous. One of the interesting things about back pain is that while the frequency, as I just described, is universal no matter where you go, disability from back pain varies tremendously. What we take from that is that the way patients frame their back pain can determine whether they're disabled from it or just inconvenienced by it.
So if a patient calls in for back pain, they're typically set up with either an orthopedic spine surgeon or a neurosurgeon. These doctors have expertise in any spinal condition. So at the first visit, they'll do a history and a physical examination. They'll look at any imaging that you brought in, including x-rays, CAT scan, MRIs. And based on that, they'll give you a diagnosis and then a treatment plan. Usually that treatment includes non-operative treatments such as medication, physical therapy, exercises, or even injections. The vast majority of spine issues don't ever end up in surgery. However, if surgery needs to be done and is indicated, we have the most highly trained spine surgeons in New Jersey with the best spine surgical outcomes. At HMH, we're on the cutting edge of spine surgical innovation. We use minimally invasive techniques with computer guidance and even robotic surgery.
Some of the approaches that we use rather than surgery would be these mind-body approaches. So in terms of the mind, education is incredibly important for people to understand how their back works, understand what their vulnerabilities are. So education is one of them. Exercise, incredibly important. If you have back pain, you can change the configuration of your back by altering your musculature, your posture. You know, physical therapy comes in many different forms. It shouldn't just be putting a hot pack on you or doing some stretches. Physical therapy should be, in many cases of back pain, actually changing your body.
Some of the newer medications are very good now that can treat the symptoms associated with lower back pain. If those things were to fail, with the most current imaging studies, we were able to isolate where the pain is actually coming from. And with that, we can direct an injection to that area to help alleviate that pain. There's certainly things that we can do to help your quality of life. So everyone's worried about surgery in hospitals now, especially with the pandemic. We have done our best to isolate all patients with COVID, and for patients undergoing elective spinal surgery, they'll have a COVID-free experience.
It's really important for you to understand that the visit with us is going to be to learn about your back, to get a home-based exercise program, but hardly ever it's going to be surgery.